needs to be for every country or every different type of populations. This is based on joint work together with Benny Pincus from Bar-Ilan University and a lot of people both in the Israeli Ministry of Health and a lot of other volunteers that help us basically design, implement, deploy, and then deprecate a contact tracing solution. So we'll start with some disclaimers. I'm a doctor, but I'm a PhD doctor, and I'm not a medical one, and I don't have any previous experience or understanding in any medical background, and it's something that I think that it's important for us as this is computer scientists to remember that we don't know everything, and we should try to listen to the actual topic experts what we want to, if we want to help them. And I do not represent the Israeli Ministry of Health, and we've cooperated with them and tried to help them with the solution. It doesn't mean that we always agreed about what and how things should be done. This talk is not about the crypto. I don't think this is that we have a nice crypto design and we have a white paper that you're more than welcome to read, but we're not going to talk about it too much. And we're going to talk about some broader aspects. And these talks describe our own views on contact tracing in Israel. We're going to talk a little bit about what is the difference between the more widely known and implemented DPS3T solution, or the one that was adopted by Google and Apple in their exposure notification, and what we did in design in Israel, and some of the things that I think that went wrong in the process. So there are basically two main takeaways that I think you can take from this talk, and if you already agree with them, so you're welcome to skip the rest of the talk or just to listen for fun. The first thing is that what I want to claim is that contact tracing and many other different type of solution is basically a trade-off between utility and privacy. And we can't get the best of both worlds all the time. We need to make some trade-offs, and the optimal trade-off is not some kind of universal truth. And here what I'm going to claim is that, for example, the optimal trade-off that we thought was the optimal, at least for Israel, might be different from some other parts of the world. And different cultures have different norms and priorities, and we should respect and address those priorities when we try to build any kind of solution. And basically that privacy should not only be done, but should manifestly and undoubtedly be seen to be done. Basically, we can design the optimal scheme which gives both utility and privacy, and it's the perfect solution, but it's going to be useless if we can't explain it to the wider public, and we can convince them to adhere to this. And the audience is not always, for example, NDSS or some kind of security conference or a bunch of cryptographic people that practice cryptography, like here in SAC, but this is the general public. It might be lawyers, it might be decision makers, and it might be the actual end users that we want to convince them. And it's very hard, I think it might be even impossible to explain the privacy that you provide to people that don't trust you. We need to have a basic amount of trust in the people that deploy the systems, if it's government, academia, industry, whatever. If people don't trust you, nothing will help. Okay, so we'll start with a very brief description of what is contact tracing. I think that at this point in time, probably most of us already know it, so we'll just go over it quickly. And basically, this is an image taken from the DPS3T documents. And the main idea here is that one of the more problematic things about the coronavirus is that the people might be contagious before they have symptoms, if they have symptoms at all. And people that have symptoms, if they are very sick with high fever, they are usually not going to infect a large number of people because they're probably going to stay at home feeling bad. But when you're feeling fine and you're already contagious, you go around in the world and you might infect other people. And those people also going to get infected, they're going to be also contagious, and again, they're going to infect other people. And this is the chain of infections, and we want to break it. and we want to cut it one step behind. So basically what we want to do is if we find that someone is already infected, is positive for COVID-19, we want to be able to notify all of its close contacts, all the people that he might have infected, and ask them to please self-isolate and go and get tested. And if they do it in time, then we will not infect other people, and we will break this chain of infections, which is something that is a very important goal in such pandemics. As computer scientists, we usually like to model things as graphs. So this is what we're going to do here. And we say there are people in the world, and those people meet each other. And at some point, one of these people, in this case Alice, might be identified as COVID-19 positive. And our goal is to be able to notify all of the people that are connected to Alice in the graph, and they're connected if they've been in close proximity under some definition. For example, the Israeli Minister of Health says more than 15 minutes and 15 minutes and under 2 meters of distance, or in a closed room together. So we're going to connect Alice in the graph to all of the other people that have been in close contact, and we want to be able to identify them and notify them that they need to go and get tested. And we should notice that we don't need to know the location of those meetings, we don't need to know the exact time, we just need to know the contact graph. And now the question is how we're going to do it. So in Israel, this in the beginning of the pandemic, we started with what is called manual epidemiological interrogation. Basically, you get a call. If you're identified as COVID-19 positive, you get a call from a nurse that tries to question you about your recent context. You ask where have you been physically, who are the people that you know that you have met, and get those details to try to notify everybody. And this is something that is very hard to scale for a large number of new positives. In Israel, we recently have a period of time where 1 out of, I think, 10,000 people each day got tested as, 1 out of 1,000 people each day got a positive result. This is something that there are not enough nurses to question everybody. And moreover, it's something that's difficult information to get. Basically, if you're in lockdown and you don't leave your house, then it's very easy to know where you've been. But under normal day-to-day activity, it's very hard to know where have you been. If I go to, this is a picture from rush hours in Israeli train, so it's very hard to know all of the people that were around you. And even if you know that you're in a supermarket at an exact point in time, you don't necessarily remember what part of the supermarket and which line you stood, and you probably don't know the other people that were around you. So how can we notify them? And so when we continue, we need to understand how it was done exactly in Israel. And here we were also asked about every public location where you visited and the exact time. So if I get interrogated, I need to say I was in the supermarket, I'm going to tell the exact time where I was in the supermarket. And those location and times were actually published in list in the beginning in newspapers and then in dedicated websites and Telegram. So in the beginning, you actually got the whole route of specific patient. You get in the paper would be published. Patient number 22 that was identified in Israel. He came from abroad, landed in the airport, then took a specific train to the market, went around. There's a lot of information. And I think that this type of information being published in newspapers, private personal information about a patient, might be something that's not very usual, for example, for people in Europe. But part of the social norm in Israel is that when someone is COVID-19 positive, everybody is going to know about it. Basically, I could have a talk with Benny, and he will tell me that he knows that the partner of the kindergarten teacher, of the son, of the school teacher, of his child was identified as COVID-19 positive, and now he's afraid that in a few days everybody will get isolated and his kid can't go to school. And this is a lot of information, and we get exposed to it all the time. And I think that basically in Israel, there isn't any strong stigma about people that are COVID-19 positive, and people talk about it relatively freely. And as an example, this is actually a screenshot from the website by the Israeli Ministry of Health that says, for example, here in the 19th of February 2021 at 9 a.m., someone was at a health provider in a specific village called Reina, and he was COVID-19 positive. And this is the type of information that's published. However, as you can understand, this is usually not very accurate, and it's not reasonable to expect all of the population to go over all of this list and try to understand if they were in close proximities to an infected person or not. And it was clear in the beginning that we need some type of automatic contact tracing. And the way that the solution that was chosen in Israel in the beginning was, I think, something that is very controversial. It's basically to take a specific anti-terror tool that was used by the Israeli security service to automatically track the whole population of Israel to try to trace people that were exposed to COVID-19 positive persons. It was probably based on data from cellular companies. It was under specific legal instructions, and they tried to preserve privacy under special rules. But you can understand that this is something that, at least in Israel, there were a lot of people that were opposed to this. This is not a normal way to react to, I think, to a pandemic, to use this type of very aggressive and invasive tools. And apart from the clear privacy violations, this tool was not very effective. The data was probably not accurate enough. There was a very large number of false positive. It only identified about 1/3 of the COVID-19 people, and there was a very difficult process of trying to appeal this quarantine. So basically, if the security service identified you as being exposed to COVID-19 positive person, you're going to get an SMS message to your phone instructing you to self-isolate. And you're required by law to do it, and you might get visits from the police to try to make sure that you're actually isolated. If you're sure this is an erroneous message, you can try to appeal. It's a very difficult process, but most of the appeals that were made were accepted. So basically, this is something that's privacy invasive and not very effective. So at that point in time, it was about March 2020. Me and Benny thought, what can we do about it? And basically, we come to the same approach as a lot of people that involved in cryptography around the world at that time, is that Bluetooth contact tracing might be a nice solution. We talked with a lot of people that were involved in the other similar approaches. And so we started to work on a Bluetooth Low Energy contact tracing scheme. And we came up with a decentralized solution called Ashomer. Ashomer is, in rough translation from Hebrew, it's called the keeper, which is a wordplay on the name of the app that was made by the Israeli Ministry of Health, which is called the Protector. And you can again see the full details in the white paper. They are not very important for this talk. And again, there were a lot of other groups all around the world doing basically very similar things, and we try to learn from them as much as possible. But as we will see, we feel that there are specific things that we want to tailor to the needs of the Israeli Ministry of Health and the State of Israel. So we'll give a short introduction for what is Bluetooth Low Energy contact tracing. And the way that it's done is basically we're going to use the fact that most of us have smartphones, and those smartphones support the technology called Bluetooth Low Energy, which is relatively close range communication. And we can try to use it to identify other devices that are in close range. And if we try to make a trivial trivial solutions, we can very quickly come up with several problems. And the first one is privacy. For example, each Bluetooth device has a unique MAC address, and we can take a solution that simply broadcasts this MAC address to the environment. But this means that you can use this technology to try to actually follow identify specific people and try to learn their location and where they go. And I think that this is something that you can easily understand that it's a very problematic tool. And there are some technical issues regarding the physical layer. For example, distance and duration estimation is something that depends on a lot of very complex physical factors, and it's very hard to model. And there are issues with the operating system that we need to send those messages in the background of the operating system. And in some cases, it might consume a large amount of energy, and people are very reluctant to give up their battery life, even if it means trying to saving actual lives, as we've seen. But we're not going to talk about most of these issues right now, most of the privacy. And one thing that it's very important for us to realize that this type of solution is only effective if both devices support the protocol. So basically, if we don't have a large adoption rate, then this is not going to be very useful. There are a lot of conflicting estimation for how much do we need, what part of the population needs to actually adopt this technology to be helpful. At the beginning, there was a large magic number of 60% of the users must install it. But even the original paper stated it's still good if, and it's still useful if a few people install. There's a large amount of recent works that try to actually quantify what the current solution actually gave, especially the Google and Apple exposure notification, and they claim that they actually saved a very large number of people, which is something that's of course good. Okay, so we'll give some background about how can we do this contact tracing. And again, because we're people that try at least to do cryptography, we like to model things with an ideal functionality. And in an ideal world, what we have is that we have a trusted third party that knows it all, and every person and every user can give the information of who they have met to this trusted party. And this trusted party knows all of the contacts that were made by different people, all of this contact graph that we've mentioned before. It doesn't necessarily know the locations, but it knows the graph. And then some person is identified as COVID-19 positive, and you can notify this functionality, the centralized output. And in this functionality, the trusted party notifies the government who are all the contacts of this sick person. And now the government can try to do, can use this information to, for example, to notify the government is not supposed to learn about the contacts of non-infected people, at least in this ideal implementation. And the other functionality is what we call the decentralized output. And here, basically, the trusted party is going to actually provide some kind of information that allows each of the contacts to learn that they were in close proximity. So they know, okay, we were in close proximity to a COVID-19 positive person. However, the government learns nothing unless those people that were infected actually voluntarily report this to the government, as in sometimes they are required by law. And this is a very important thing. And now we need to understand how we can actually try to implement such solutions in real life. So the basic centralized design is and it's not an exact way. This is some schemes around the world implemented the centralized design. And this is not an exact description of how it was done. This is a bit simplified so we can understand the main idea. So, for example, the government can actually choose the values that are sent over Bluetooth energy. So, to simplify things, each device might encrypt its identity and maybe the time that it was sent under a public key that was chosen by the government, and then broadcast it over the BLE. Users who receive this such message is going to keep them locally on their device, but they cannot decrypt it. They cannot learn the identity of the senders of these messages. And now, when the user is sick, his app is going to upload to a government server all of the encrypted IDs that it receives. And then the government is able to decrypt it because it has the private key. And then it learns the identity of all of the people that were in close contact. And the government can notify them to quarantine. This, of course, can be misused by the government in several ways. For example, the government might try to subpoena or compromise in some other way the IDs that are stored on a user device, even if it's not COVID-19 positive. The government might use passive receivers to track people of interest all over the country or in specific places, like specific demonstrations or other points of interest, and again, without any connection to any health issues. And there are many other ways that this might be compromised. And as far as we know, this is not some kind of theoretical threat. It's something that we know that it has been either done in some variant or people or some government consider doing it. For example, in demonstrations in different parts of the world. And this is something that, at least I personally think, is a great risk to provide the government with such tools when we have no way to actually make sure that they are not misused. On the other hand, the approach that we, most other solutions, at least the ones that were made by academia people, is the decentralized approach. Here, we say that our basic claim is that user must trust the system, must trust that it preserves the rights of both privacy and accuracy. Otherwise, they're not going to try to use it. They might try to cheat. For example, in Israel, due to the tools, the security service tool, sometimes people simply decided to leave their smartphones at home when they went for shopping or meeting other people because they didn't want to take the risk that they either be tracked or get false positive quarantine messages. And basically, governments may try to find ways to fight this cheating, but then we get this kind of cat and mouse game, and we at least don't think that we want to get to this point. And again, you can go to what I feel is extreme measures that people need to, every time they go, for example, on a train or a public place, they need to show that, for example, what we're going to talk about, either a health passport or something that proves the current state and the fact that they are being tracked, but we feel this is a problematic solution. Okay, so if we want, so how can we do it in a way that we can actually prove that the privacy of the user is being maintained, even if the government tried to misuse it? So this is the basic decentralized design. For example, about every 5 minutes, each device is going to pick completely random value and broadcast it over Bluetooth Low Energy. If a user is COVID-19 positive, you can choose, hopefully voluntarily, to give the government the list of values that was broadcast by his or her device. And then the government can broadcast these random values to all the users of the system. And then each user can locally, on its own device, compare the list of values that they received to the list of values that are stored on their device from the BLE messages. If there is a match, then they know that they were exposed to or in close contact with the COVID-19 person, and now they can choose if they think that this is a true positive or false negative, if they want to report it to the government or to voluntarily self-isolate without reporting. The response is up to them. Okay, and again, actually, they might be required by law to report the fact that they got a message, but technologically, there's no way for the government to actually enforce it. And this basic approach is pretty much in consensus for people that try to implement this kind of systems. However, there are still a lot of trade-offs that can be made even in the decentralized solution. Here, I want to talk a little bit about the specific trade-offs. And here, we're going to compare our Ashama solution to the one that was proposed by the DISRPT and adopted by Google and Apple. Okay. So I think the first and maybe one of the most important trade-offs is the infected person's privacy versus the explainability to the people that get the exposure notification. So basically, if we want to take the side of privacy, we're going to give the minimal amount of information needed in our exposure notification. And basically, it gives you one bit of information that you are exposed and the day of the exposure. And we need to also give the day because usually there is a requirement to self-isolate, for example, for 14 days after you got exposed, and you need to know how much time you need to stay at home. So you need to know the date. But basically, this is it. You get this very laconic message, and now you need to trust the system and go and get self-isolated. On the other hand, we might try to actually help the user trust the system by giving a lot of information about the exposure that allows him to realize that if this exposure really happened in reality or not. For example, we might tell you that the user that you are exposed on Thursday in this specific hour, this is the infected person that you are exposed to, and this is the exact location. And this is something that can help the user to actually make sure that you don't get a false positive. For example, if I get a message, exposure message saying that I was exposed to someone that at the time that I know that I was at home and he wasn't around, then I know this is a false positive. If it's someone that I can recognize that I actually met, I know, okay, this is a true positive. And Eyal, we felt that due to all of the evidence quarantine messages from the previous tools that were made, we thought that the public trust in this type of systems is not going to be very high. So we wanted to give some kind of information for people to decide if this is actually a true encounter or not, but we didn't want to give them that much information, of course. So we took a middle ground, which basically says we tell you the date that you are exposed and coarse grain time information. Basically means, for example, between 8:30 and 8:45. And here you can know if you're in a supermarket at this point or you were at home, and you can try to understand the validity of the message. Although we must note that this implicitly allows the user to also learn the location of the exposure. And this is basically because I can have device track my location and locally store my GPS coordinate. Then you can check and say, okay, at that point in time, I was at a specific location. And then I know that this is where the exposure really happened. And in that case, we feel that if people can implicitly learn it, maybe we can also give them this information because it will help them make the right decision. And if they're malicious or try to misuse the system, they're already going to learn this information about the infected person. Okay. By the way, if people have questions during the talk, you can try to write them in the chat or raise their hand, and I will try to answer if it's possible. If not, we'll be happy to answer in the end. So we need to talk a little bit about the infected person's privacy. And in the JAPL solution, as I will call it from now, ephemeral IDs are derived deterministically as a function of time. And they want to hide the exact time of the contact. So what we can, when you receive an infected person key, each user can duplicate the derivation process and compare the derived ID with the stored one. And this actually reveals the time that the message was sent. And also we can simply store the time where you got this token. So how can we keep the exact time private? And in the original DSRPT solution, we basically the sender randomizes the IDs order before sending, and the user also needs to randomize the way that they are stored on device as to not keep this information. And again, if you have any user that want to try to misuse the system, they can actually store the time when they receive the message. In the GAPL solution, they did a simpler, they took a simpler approach, basically saying that we're going to check this in a privileged code, a system code that the user is not accessible to. So if the device is not rooted, you can't learn anything. If you are able to root your device, then you can get all of the information that you want. Okay. So now we're going to talk about an interesting trade-off, which is not completely unique to Israel, but I think it may be more important to for the state of Israel than for other places. And this is a trade-off between location privacy and the coverage, the amount of coverage you have on the population. So basically, what we assume in this type of contact tracing schemes is that all of the people use smartphones and they installed this Bluetooth contact tracing application. However, we might have whole populations that don't play in this game. For example, in Israel, we have a large percentage of ultra-Orthodox religious Jews that do not use smartphone for religious reasons. And they have what are called kosher phones, and those phones do not support this, any kind of application. So we have whole cities where most of the population can't use our application. So nevertheless, what can we do about, how can we give some protection for this population? And moreover, because people with kosher phones or without smartphones do not stay just in specific locations, but they mix with the general population, how can we try to notify general population from with contacts from other people? And really, relatively early on, think about May 2020, the Ministry of Health released an application called Amagen 1.0, and which is a decentralized GPS-based solution. And in this solution, the device can receive a list of infected persons' location, and it compared to the user's own GPS history. And the alerts are local, nothing leaves the device, and privacy-wise, this is actually a relatively good solution. You can ask where can we get the list of location, and this goes back to the manual interrogation that we talked about. And now, if a nurse contacts an infected person, it tells her that he was in a specific supermarket. For example, here a supermarket called Shefa Bracha. This is the actual notification from the application. And in that case, this list goes to the application. It's broadcast to users, and then each user can check if he was in the same location at roughly the same time. So this is something that's not very good to the privacy of the infected people, but it's very good for the privacy of the general population, and it can also handle the fact that the infected person does not have any kind of application or smartphone at all. However, we still have the problem that GPS has a relatively low accuracy, especially in building. So this means we usually need to increase the range that considered for contact, and this results in a large number of false positives. So people might not trust this system. And on the other hand, we have this BLE-based solution that has much better accuracy, but only partial coverage. And then the question that we have, why can't we use both? Maybe we can incorporate this GPS solution with the Bluetooth low energy, and then get the best of both worlds. And the reason why we can't do both is that Google and Apple decided that we are not allowed to do it. Basically, as stated before, actually implementing these BLE solutions without the support of Google and Apple is something that's very technically challenging. And Google and Apple provides an API for their own variant of contact tracing based again on this RPT. However, they limit the usage of this API to only to approve applications that are, and those applications has to follow specific rules. One of them is that the application must not have access to any kind of location information. And this is true even if this is a decentralized local use, even when the app is voluntary, even when we can allow the users to voluntarily choose if they want to collect location data or not. And even if, as we've seen, Google might still be able to collect GPS data while use the contact tracing, but this type of apps are not able to. And we actually been in discussions with people from Google and Apple and the Israeli Ministry of Health, try to explain them the specific requirements and needs in Israel, and basically said, no, we're not going to provide you with this ability. You're blocked out of the application if you want to use it. And this was already a deal breaker for the Ministry of Health to try to implement their own solution. However, there are other things that were again problematic, and one of them is something that has been talked about quite a lot in various recent papers and talks, and basically is that the GAPL solution is vulnerable to relay attacks. And there's a very simple attack scenario. We can say, for example, a Bluetooth receiver is placed in some kind of emergency room in the hospital, and we can safely assume that there is going to be a large number of COVID-19 positive persons that are going to be around this receiver. And then it's going to relay those messages to, for example, a busy supermarket or a train station. It basically means that everybody that are in those places are going to get notified exposure notification. And this attack, again, has been at least partly demonstrated against this CPT, and there are a lot of concerns raised about how this can be misused in large scale. And so, for example, we might have very targeted attack. For example, in Israel, there are cases, for example, of spouse abuse, where someone will send fake warranty SMS messages to an ex-partner to try to cause people to go into quarantine. And again, because it's hard to try to get out of this quarantine, and this is something that's very can really help people's life. And there's the possibility of mass scale attacks. And here we have several options. For example, if we have a large number of false positives, it's basically going to reduce the trust in the system, and the system will not be useful anymore. And it can also cause alarm in the public or affect behavior. For example, this type of attacks might be done in targeted locations before elections to try to motivate specific people not to go and vote. And this is something that, at least I feel, is a really major concern. And one can say, okay, what can we do to protect against it? Basically, Google and Apple decided they're insecure and they're not going to solve it, and this is acceptable risk by them. Again, this is a decision that was made by two large corporations, and it was not made by any kind of public organization or government to make this decision. What we suggest is basically sending an encrypted version of the user's calls geohash. We know that the receiver is supposed to be in the same location. So if we, for example, give location and resolution for a few hundred meters, the receiver already knows where it is located. So it doesn't reveal any kind of extra information. And if we use authenticated encryption under keys that are later disclosed to the server, if the user is identified as an infected person, this is not something that is easily to spoof. And again, we can do it in a way that the server does not learn the location. Only the receivers of the daily messages will get this location, then they can compare it with their own location history. Again, there are many other variants that can be made. There are some solutions that were proposed for it, but I think the main question is, do we want to protect against this type of threats or not? And who makes the decision if those threats need to be handled? Is it a government, a public organization, the Ministry of Health, or some corporation that builds the smartphones? Another thing, something that's very important when you design this type of systems, and this is actually in the way that you design and build the applications that users use, is what can you do to try to prevent coercion as much as possible. We believe that we need to allow the users to make their own choices regarding the usage of the application in order to get the user's trust. Again, if we don't get the trust, the people are going to try to cheat out of this game. So I think the app usage must be voluntary. So it shouldn't be mandated by law. And I think it's a law that's very hard to actually enforce. Another bill talks about it in Israel, and I'm glad to, and I was very glad to hear that they decided to drop this type of mandate. However, users still might be coerced to install specific application, for example, by employers that might want to check that when I go to work, my employer is going to check that the app is installed on my phone. So even if a user installs this application, we still must give him a lot of options. For example, we want to give him the option to decide if a specific notification is correct or not. We want to choose whatever to notify the authorities or not, and to be able to disable Bluetooth transmission or reception for specific time periods, to delete its own cryptographic keys or messages that is sent for specific time intervals, and also to delete notification history. For example, when I go to work, my employer might ask me to show its notification history, and if I decided a notification was erroneous, it still might not allow me to come to work. We want to give the user the option to delete this, so we can still show the application and show a clean sheet to its employer. And again, if we don't give these options, people will find a way to cheat. And we want to hope that out of solidarity or other reasons, most users will do the right thing. Otherwise, and this is a matter of public trust, otherwise, I don't think that we have a chance in the first place. And when you do this type of application, there are some legal reasons that, that we need to think about at least. And for example, should the user report an exposure? So if Alice gets an exposure notification, and Alice knows that this is likely true, at least in Israel, she's legally required to report it to the government. The app, however, does not force her to do it in any way, and it will even allow Alice to delete this notification. So this app basically can allow people to break the law, and this is something that might be difficult for people that, for example, in the Ministry of Health to give this option, but even if this is something that's very important. Okay, so we did the design, we're not going to the details. And after a lot of hard technical work, I'm again 2.0, which includes the Bluetooth low energy contact tracing option, launched in the end of July 2020. And this was without the Google Apple API. And again, it took many few months to bypass several limitations from the operating system. It worked well on Android, but in iOS devices, it was only able to receive messages, not to send them. But again, the trade-offs that were decided by the Israeli Ministry of Health said, okay, this still will give us a much larger coverage, especially as iOS is not very popular in Israel. And again, you can see design and reference of the implementation. And we did a very long and tedious process of trying to consult a lot of other privacy experts in Israel. I mean, both cryptographers. We're not privacy experts, and we wanted to get their opinion about what we do, what we can do better. And it was basically endorsed as a very good privacy preserving solution, especially compared to the other alternatives. And after that, the public simply did not install the app. As far as I'm concerned, even if some other people might think otherwise, I think it was basically a colossal failure, and it was basically deprecated a couple of months afterward. And we can ask ourselves basically what went wrong. And there were some technical issues with development and the implementation, but basically it goes back to the fact that, as we said before, the privacy was basically done, but it was not shown to be done. It was not explained to the public. And the application was deployed where in the background we have general distrust of the government handling of the whole COVID-19 situation. There was the previous security service tool. And basically what happened is that most of the public actually viewed this application as another surveillance tool. And this was somewhat, there was not good enough effort to try to explain to people what is the difference and how this application works, what is it useful for. And we actually think that part of the government wanted the app to fail, because one of the reasons it was deployed when it was deployed was that the Supreme Court in Israel mandated the government to try to find alternatives to the security service tool. And if we actually deploy an alternative and it failed, then it gives them a very good excuse to keep on using the other approach. And this is a bit sad, but again, this is about trust. And I want to share with you another anecdote that we had while trying to speak with work with the Ministry of Health. And even after this, the application was deployed, they approached us and said that they want some kind of telemetry to learn how people use the help. And this is something that was crucial to them to be able to improve the application, to learn if it's useful or not. And if we want to prove that this is a good alternative, we need to show that this is actually used in some way. And the people that I talked with them were very concerned about privacy issues, so they didn't allow any telemetry to be sent from the devices. And so they wanted to find a privacy preserving solution. So we suggested to them to have a solution based on the Puyo paper that is currently used by Firefox for telemetry. And that it's basically a relatively simple multi-party solution where the data is shared between two servers. We propose that one server is going to be operated by the Ministry of Health, and the other one is going to be operated by some trusted independent entity, for example, Tel Aviv University. And basically, the multi-party, two-party computation ensures that the Ministry of Health can only learn aggregated statistics. You can add also differential privacy for those statistics. And the server that's going to be for example, in this example in Tel Aviv University is going to learn nothing. So no information is shared with outside the server. So we talked with technical people, and they were very excited, and we started to talk about, we talked with Dan Bonnet that agreed to help us with implementing it, and then there was one final thing that we had to do, is we need to get approval of the legal department in the Ministry of Health to the way that we collect the data. And we had a very long conversation in which we completely failed to convey our notion of distributed trust. The lawyers vetoed any kind of use of any server outside the control of the Ministry of Health. They said they're not going to allow private medical information of the Israeli population to be shared outside. And we tried to explain to them, no, we have this cool mathematical cryptographical solution called two-party computation. That server actually learns nothing. We can try to prove it to you. We weren't able to explain it the way that they could understand. And from their point of view, we say, okay, if the legal department is going to state that we're only going to compute and use aggregated statistics, this should be enough for the public. And we're not very concerned about side issues. Okay, what happens later if we get a subpoena, or if these servers get compromised, and how data is actually, if it's possible to collect data without actually keeping any personal identification. They have the legal resolution, and this should be enough. And this is something that is a common problem when we try to actually get people to adopt this kind of new solutions. If we can't explain it to them, they're not going to use it. And I'm going to use, maybe I think we have about 10 minutes left. I'm going to use 5 minutes to talk about vaccination passports in Israel, and then we'll be happy to take questions. So a few months ago, the Israeli Ministry of Health started to work on vaccination passports that are supposed to be used for international travel, and what is called the digital green pass, which is supposed to be used for internal needs in Israel. And basically the idea is that I need to show some kind of proof for my medical status, if either I'm vaccinated or I'm recovered from COVID, or I got recently tested. So to verify that I'm most probably not contagious before I go, for example, to the theater. And this raises a lot of very complex and deep trade-offs and issues regarding the people's right compared to our needs to try to combat the disease. And the first and very important question, which I'm not sure that was asked enough, is it necessary? Do we know that this is actually the best way to try to combat the pandemic? Are we right in actually preventing the right of movement, of the right to work for certain people, in order to prevent them from being a risk to others? And can we actually say that vaccinated people are much less of a risk than people that are not vaccinated? And although I'm pro-vaccination and I support this, I think that we at least need to have a much better discussion than what we had, at least in Israel, about the necessity. And even if we decide this is something that's necessary, we need to ask ourselves, is it discriminatory? And I think that when we talk about international travel, then we know that there are large parts of the world that don't have the access to vaccines that some other countries have. And if we restrict travel to only people that are vaccinated, we're going to be discriminatory against a large percentage of Earth's population. And however, if we look specifically inside Israel, Israel has a very good vaccination coverage. Basically, every person that wants to get vaccinated is able to do it. It is free. It is relatively easy. And there's also a relatively widespread and easy and efficient way to get tested if you don't want to get vaccinated. So it may be inside Israel, it can be considered less discriminatory than other things, although there is still very large, very strong objection from several parts of the population against this usage. And if we did this discussion, which again was not made, I think, adequately, and we decide we want to implement it, now I need to ask ourselves, how can we implement it? And the first approach that was taken by the Israeli Ministry of Health was the use of animation. Basically, you have an application that contacts the Israeli of Health server, and it will check your vaccination or test status. And if you get the digital green pass, this application will allow you to show this green animation. And you can show it to the security guard and the entrance to a location, then you're supposed to be able to get in. We had some talk with the Israeli Ministry of Health, and we tried to explain to them that animation is not a very secure way to authenticate information. And after a while, they came up with decided, okay, we want to get to have a better solution. Basically, it allows people to verify cryptographically the status of the green pass. And here again, we have two approaches. And the first approach that was considered was the centralized or online solution, which basically means every time you want to prove that you are on a digital green pass, the verifier is going to contact the Israeli Ministry of Health servers and going to check your status with them. It has some benefits. For example, it's very easy to revoke certificates. For example, I might have a green pass because I was vaccinated, but I got tested yesterday and I got a positive result. So I shouldn't be able to have a green pass anymore. And although it's very difficult to revoke efficiently a large number of certificates, and here you can have this own information. However, it has a lot of possibilities for misuse. Again, this allows the Ministry of Health to track the movement of users around the country, to learn when the time wherever I presented this green pass and where in what location I did this. And it's also very inefficient. For example, you need to be online to check it. So if you don't have internet connection, you can't check anything. And there is the offline check solution, which can be relatively easily implemented using a digital signature. Basically, I'm going to get a QR code from the Ministry of Health that encodes a digital signature on my green pass. However, this still may allow some personal info to be linked to people or to be leaked. And for example, this might be done via wrong usage. People in Israel at least get confused between vaccination passports, which are for international use, and actually store vast amount of personal information. You get your passport number, you get the exact dates where you got vaccinated, which is what health provider you have, not of personal details. Compared to the green pass, it basically has the expiration date. But it wasn't explained to the public which solutions you should use. And actually seeing people that walk around with the QR code of the vaccination passport that stores all of this personal information in the clear, and they printed it on a page and put it on a string on their chest, because it's easier for them to show it around. So basically people go around and broadcast their personal information. And even if they use the green pass, still some personal information might be leaked. For example, the green pass in Israel currently shows the expiration date. But the expiration date actually reveals what is your medical status. Because the expiration date is 6 months after the last vaccination jab that you got. So you know if you got vaccinated, you know if you are an early adopter of vaccines or not, because if I know your age, then I know when was the first date you're eligible for vaccination, you know how much time it took you to decide to get this vaccination. If at some point, all of the people that were recovered from COVID-19 had the same expiration date, just a fixed date. So I know everybody that has this expiration date is probably has been infected by COVID, and anyone that get tested, it has a 3 days expiration period. So we know that they got tested, they are not vaccinated, and we know the date of when they got tested. And this is a lot of private information that is not actually needed to be revealed, because when I come to the university, and currently I'm required to show the green pass, all of the information that I actually need to reveal is the fact that I currently, this day, have a valid green pass, and nothing more. And when after all is said and done, and they have application to try to scan these barcodes, and basically the way that it's implemented in the real world is relatively different. For example, the first day that the Green Pass was mandated in the university, we had a very long traffic jam in the entrance to the university because it took them a long time to check them. At some point, they decided, okay, we can't do it anymore, so just let everybody in without checking them. And today, I came to the security guard. I showed him my phone with a QR code, very large QR code, and an ID number. He looked at his QR code and said, okay, you can go in. So either he has the ability to actually read the very small print of my ID number, compare it in his hand to the list of people that work in the university, knowing that, okay, this is, get my picture, see that it's actually me, and then verify the RSA signature that is inside this QR code and everything in his head. If he was able to do it, then this actually works. Otherwise, we did all of this Green Pass in digital pass in something that I could just write my own note saying that I'm okay. In conclusion, I think the most important thing that for us, the people that try to design and implement this type of systems, and it can be contact tracing, it can be encryption schemes, VPNs, or whatever, we need to find a better way to communicate these relative complex issues to the general public, to try to convince them of the security and the privacy guarantees that we can have. We need to remember that different countries have different norms regarding privacy, regarding security, different trade-offs, and we need to build the tools that people will want to use and not the tools that we think that they should use. And I want to believe that Google and Apple care about users' privacy, and they wanted to provide a clean, decentralized solution and to prevent government to try to misuse it. But in fact, they coerced governments into using their own specific product without any modification, and this might lead to worse tools. It might prevent the use of life-saving tools at all, and it prevents any kind of competition or evolution of other solutions, such as different protocol or hardware stacks. And we need to think really hard about what is the amount of power we want to give these corporations on our everyday lives and the decisions that affects them. And to summarize, I will be happy to answer any questions. And again, I think that the best solutions that we still have are the maybe already known ones. We should wear a mask, wash our hands, social distancing, and get vaccinations if you can get them. Thank you very much, and I'll be happy to answer any questions.
Thank you so much, Eyal. It's a very nice talk. It's not so technical, so a lot of ideas can be like thought about. We are here in Canada also experiencing the same issues with the vaccine card. We call it here. It's like the Green Pass. We don't still have the one for international travel. And also we carry the QR code on our phones here in BC. And what is happening is that it's just a QR code. It doesn't have any identity or anything. And when you're going in any restaurant or any non-essential place, you just show it. I'm not sure what do they fear out of it, but they say, okay, pass. So I'm like, okay, if I take this QR code and distribute it to everyone around me, even if they are not vaccinated, or anyone can just print any Photoshop a QR code and all of them are working. So I'm still not sure how it can be enforced, but yeah, the same social problems, I think, with especially the one inside, not the passport, but the one that is used inside cities, I'm not sure how it can be solved. So I have a question about your contract tracing app. So you said that it was deployed for some time by the Ministry of Health. It was like in combination with the like the security service tracking, or it was standalone for contract tracing at the time that it was deployed?
It was deployed as a standalone solution that was operated by the Ministry of Health, and it didn't. The security service tool was still used in parallel,
Yeah.
but it was operated by the security service and not by the Ministry of Health, which is one of the many problems that we have with this. And I think that's basically right now both of them are not being used anymore, especially as the number of new COVID cases each day is so large that it doesn't really matter anymore. There is a point where there's too many cases and even these automatic tools are not really helpful.
Yeah. So you don't have any idea about, at the time that it was used, the compliance rate for self-isolation because you leave all control to the people. So you rely that when they receive the random, they receive the randoms from a person who chose to notify that they are sick, they will self-isolate, right? That's their choice.
Yeah, and we don't have any statistics because again, we want to allow to implement the privacy-preserving telemetry solution. And there are research papers about the Google Apple exposure notification that they say that there they claim that it did help, so people self-isolate. And I can, from my own personal surrounding, I know of a lot of cases where people got notified about exposure using personal contact. So, okay, someone calls me and say, okay, I was infected, and at least I did self-isolate when I heard it, and I know that a lot of people did so. So I want to be optimistic and try to believe that people will do the right thing when they get the choice.
Yeah, right. We all should do that. I'm not sure if something like this is. I don't think it's used, at least here in BC, because self-isolation is enforceable here. Like what you said, the security solution stuff. I don't think they use here security solution stuff. It's more of the manual contact tracing, but it's enforceable. So I'm not sure it is not enforceable in this case at your side, right?
Yeah.
Okay. So yeah, that's it for me. Anyone has any questions? Please feel free either to type or unmute yourself and go ahead and ask. Let's give them a moment. So yeah, apparently we don't have any questions. Again, I thank you, Eyal, for the talk, and wish you the best of luck in your efforts with the Israeli government.
Thank you for the invite.
Thank you so much. Thank you so much for coming here today, and thank you everyone for attending, and see you all tomorrow, last day of SAC. Thank you.
Yep.
Bye.